Okay, so good afternoon, everybody, or good morning, or good evening, or good whenever you're watching this. If you got this far, congratulations for being able to navigate through Edpuzzle. I know it's somewhat of a different platform for us right now, but I think it'll be beneficial because I'm going to be able to embed questions throughout this presentation and then some at the end too, kind of like we do usually with Nearpod, but this just kind of encompasses everything for me. So so to begin with, and thinking about what we discussed on Thursday, let's take a look at this question here. Moving along, let's get to where we were. So we were at this point here. So we talked about the sleep and rest pattern that older adults, middle-aged folk get less time in deep sleep and then less sleep overall. A lot of factors that kind of feed into that: too much caffeine, if they're exercising a couple of hours within going to sleep, or if they have that failure to have regular sleep wake schedule, going to bed at different times at night, waking up at different times in the morning. All that can impact their sleep. And also, if they could develop insomnia from that too. I'd be willing to bet that's probably a fairly common complaint among folks that are middle aged, especially if they have a lot going on in their lives. I'm kind of proof positive of that, as we've talked about in class. So, what do we tell these folks? Regular sleep schedule. Get good quality sleep if they can. Avoid outside distractions and these types of things. Some people might sleep with white noise. I know that around here I can't sleep without the fan on, just because I need that white noise to help me sleep. And again, like I said in class, I like the idea of the occasional napping. I don't think that's realistic for most of the middle-aged population. But you know what? If they had an opportunity to take a nap here and there, I say go for it. There's cognitive behavioral therapy for sleep problems. Really, as we've talked about with other issues, we want to make sure that we're coming up with other solutions before we just defer to medication. Right? We don't want somebody to have to depend upon taking medications to be able to sleep. Most of the time, we want to talk about other things that they can do. And again, it goes back to that, you know. Regularly scheduled sleep, going to bed at the same time, waking up at the same time, and trying to diminish the amount of distractions they may have, or those things that might keep them awake at night. So let's move on from there. This is a new slide for us. Roles and relationship pattern. We've all heard of the midlife crisis. So folks, the thought process here is that folks get to be to their middle ages and they start to kind of reevaluate where they are in life. Right? What haven't they done? What have they regretted not doing? These types of things. They might be causes of stress for these folks. So, my midlife crisis was probably leaving one job and then getting to come and teach you guys. So that's a pretty cool midlife crisis as far as I'm concerned. Worked out pretty well for me. But we know that, you've seen the jokes out there where all of a sudden the men start coloring their hair or going out and buying expensive vehicles or those types of things, trying to hold on to the youth that is starting to escape them, really. I mean, that's kind of what's going on here. And people start to make changes in their lives based upon their experiences or potentially those things that they didn't do. When we think about families in this age range, again, remember, this is the 30s through the 60s, the 35-year-old through the 65-year-old. So there's a lot of stuff going on there, right? At the beginning of this, probably, 35 years old, I think back to when I was 35, and, I had 3 kids that were in their early teens. And now I'm older than that, and I have 3 kids. My daughter tomorrow on Sunday turns 24, so yikes. So as you can see these differences in the families throughout this entire age range. So you have families with children, ages 13 to 20. You have families launching young adults. We've talked about that concept of launching before, right? Helping them complete their high school education, complete their college education if they decided to, and help launch the children into their own lives. And then we see that kind of the tail end of this age range is that going from empty nesters to retirement. Um, I would expect, my wife and I right now, you can consider us empty nesters, and it was a bit of an adjustment, I would say. And you think of people that are in their early 60s are moving from that empty nest syndrome into retirement. So the other thing that we need to consider with these folks, that they have multiple responsibilities, and that's not saying that young adults don't, because young adults, as we've talked about, have multiple responsibilities as well. They may just be a little different. Um, when I think about multiple responsibilities in this age range, I've said it before, that sandwich generation. So you have folks in this generation that are helping their younger children, their young adults, launch into their lives, and at the same time they have the aged parents that they're trying to take care of as well. I'm the poster boy for that. I think I've talked about that before in this class. I have my 3 children that over the last 2 or 3 years have graduated from college, and we're trying to help them get established in their lives. And at the same time, now we have my father who's had health issues, and we've had to move into a nursing home. So the brunt of that responsibility falls on me in this generation, my wife and I. So that's a perfect example of, the children, the aging parents, those types of things, and job responsibilities, right? When you start out in a job, your responsibility level might be lower than somebody that's been in a job for many, many years. I'll default to when I was on the fire department. When I started out, I was there, I was learning. I didn't have a lot of responsibilities other than to show up for work and follow orders. But as my career moved on and as I moved into middle age, my responsibilities as far as my job was concerned increased as well, right? I wasn't the person that was learning anymore. I was the person that was teaching and leading and these types of things. So that brought with it an entirely new set of stresses and responsibilities. Um, and then as well civic responsibilities. So being involved in the community, be it with volunteer organizations or whatever civic organizations people might be interested in being a part of. Now, middle-aged adults, now that they've launched their young adults into their own lives, or they have that empty nest syndrome, they might start thinking about, what are their civic responsibilities, taking part on boards of directors or in volunteer organizations and these types of things, right? Um, a lot of times we've talked about divorce before in this course too, right? So you might have quite a few families that are just that. They're single parent families. So now you have a single parent that is taking care of their children, that is taking care of maybe their aged parents, that's worrying about job and all these things. So think about all the stresses that they might be going under. And adult children at home. That brings with it an entirely new set of parameters for somebody. You've launched your children, but for one reason or another, they end up back at home with you. So there's definitely a different dichotomy that goes on there. Empty nest syndrome, kind of talked about already. Over involvement with children's activities. And I think of this as the families with children, that 13 to 20. And I really wish right now we were sitting in the classroom, because I would ask the question, which of you's parents were overly involved in your activities? And I know we kind of talked about it before, but I'm thinking about that, the parent that's the hockey parent, right? The hockey mom, the hockey dad, the soccer mom, the soccer dad, that is overly involved in their activities. In a good, that could be a good way, right? Their parents are coaching, their parents are taking part in the board of directors, but on the flip side of that, their parents are also the ones that go to these events and are banging on the glass of the hockey games or yelling at the referees or something like that, just because they want what's best for their kids. Sometimes they just express it wrong, right? I really wish that we were in the classroom for that one, and I might bring that back up again just to see what the reaction from a lot of you guys are, because I know a lot of you played youth sports, you took part in youth activities, be it dance or cheerleading or those types of things. So that over involvement, that overindulgent parent, I guarantee you that you could either say that was my mom or dad, or you can remember another player or participant's parent acting that way. So I'd be interested to see where that goes. So work, as we know, when we talked about the young adults, right, work plays a huge part in their life. Well, it's no different now, right? It plays a major role in a middle-aged adult's level of wellness, their self-esteem, right? They get up in the morning, got a job to go to. Granted, it could be a cause of stress, but it also helps their self-esteem. They feel good about themselves because they're out there, they're making a paycheck, keeping a roof over their head, these types of things. The one caveat here, as far as work is concerned, and I'll mention this, and we've talked about this before, every year, statistically, they're showing there's about 2.9 million work-related injuries every year. And the highest rates of those injuries come from three places: construction, manufacturing, and, yeah, you got it, health services. I'm hoping this is going to work. I'm going to minimize the PowerPoint for right now. In Blackboard, I actually have a link to the NIOSH site. So if you get a chance, or if you want to, I'm going to show it to you now. Go to the NIOSH site, and this talks about healthcare workers. And as you scroll down here, there's this safety and health information for healthcare workers. All different types of information in that, but what I kind of have, there's three different agents I think of here, right? Three different hazards that as healthcare workers, people should be worried about, really. Infectious agents. It goes without saying that in the healthcare environment, right, we're going to be exposed to infectious agents. Chemical hazards, be it from medications that we're giving, something as simple as, and you guys will get to this when you start doing clinicals, but like if I were to give a medication such as fentanyl, we've all kind of talked about fentanyl, it's a narcotic, it's highly potent. But even if I was preparing that and I need to get like an air bubble out of the syringe, I would need to wear gloves because it was a chemical hazard because it could be absorbed through the skin. So if I'm not wearing gloves and I get an air bubble out of a syringe and I actually drop some of the fentanyl on my hand, guess what? It's going to absorb into my system. The other one I want to kind of highlight here are these physical hazards. I can't say enough from the get-go to have good ergonomics in the clinical area and to be very careful about musculoskeletal disorders and injuries. The last thing that you want is to injure your back lifting a patient wrong. Goodness knows I wasn't taught the right way 30 plus years ago, and to this day I still have issues related to that with my lower back and such. But as you scroll down through this as well too, there's a bunch of different, and I'm not going to click on any of these, I'm just showing you these to highlight them. So we're worried about ergonomics, worried about lifting patients, how you sit at work, right? Things that might happen to your muscles and your skeleton secondarily to that. And then there's safety issues, and then there's violence, which is kind of a big thing now in the healthcare environment. It's always been there, but thankfully we're starting to talk about it a lot more. The Emergency Nurses Association just came out with a whole program about, enough is enough. It's time to say enough is the violence towards healthcare workers needs to end. And there's a whole bunch of stuff here. There's a couple of videos on the bottom down here where they have nurses, and they're short snippets. I'm not going to play them now, but there's probably only about 2 minutes worth of videos there if you wanted to look at them, where these are nurses that were victims of violence in the healthcare setting, and the effects of that afterwards. So just something to be aware of there. So let's bring our PowerPoint back up here again. A lot of times, as far as roles and relationships are concerned, you've got 2 or more job families. I know that in this household here, right, for a very long time, I've talked before about how I was a firefighter and I was a nurse. Well, I had 2 jobs, and my wife she worked for a company as a consultant, and she was an educator. So we had 4 or 5 jobs between the 2 of us. So that in and of itself can impact the roles, the relationships pattern. It can add stress to the family if there isn't good communication there. The other thing that we talk about here too is job-related travel. So a lot of times she would be out of town, so the responsibilities of the household would come to me, or vice versa if I happen to be out of town or when I would go to work for a 24-hour shift, right? The other thing that's noted as a bullet point here is that re-entering the workforce. So we're talking about the middle-aged folks where maybe you have a stay-at-home mom that stayed at home until their children hit their teenage years, and now guess what? They're re-entering the workforce. So that could change the dynamics in a household. I know that when I first went to nursing school, a very, very long time ago, before all of you guys were born, so let's just not even go there, I had quite a few people in my class that were just that. They were moms whose children had reached the point where they were off to school, and the mom's responsibilities at home had decreased. So they were kind of like, okay, what do I do now? So it wasn't exactly a midlife crisis, but in a couple of cases it may have been, right. They were towards the middle of middle age, and so they re-entered the workforce. But think about the changes that would go on in a household and the roles and the relationships between everybody there. That could have an impact on that. Caring for aging patients. You guys are probably tired of hearing me talk about it, but right here, there's that sandwich generation term, right? There might be changing parental living arrangements. I know we've talked about it in class before, where gram or gramp come and they live with you, with the family. That might work. But there again, think about the dynamics of that household that are going to change. When it's mom and dad and kids, a household runs one way. If you add another variable into that, like a grandparent, that could add stress to that household, right? Because things need to change at that point. And the important thing there as nurses, if we have the opportunity, is to discuss issues before they become a crisis. Encourage the families to do that, but also encourage families that might be thinking about this. Maybe you're working somewhere where you have an aged patient, an elderly patient, and they're considering moving in with their children, with their middle-aged children. That might be a conversation to have. Like it may not be a seamless process. So. We've talked about divorce quite a bit in the previous chapters. Same thing goes here too. There's a lot of adaptation that has to occur. And also, there's a potential psychological effects on the children. So maybe you're in an environment where you're working with a middle-aged person, but might be going through a divorce, and they have children. What are the effects on the children as well? And is there counseling or other resources that we can offer at that point? Also, death of a spouse can have an enormous impact on the surviving spouse, on the family. You've got this. You have people that have been together for a very long time, and as they approach the end of the middle-aged term, right? They're talking about retiring. They're talking about what comes next, and that the death of one of the spouses, one of the partners, that could have a huge impact on somebody, because at that point, right, that future they thought they had all planned out is gone. And also individually in those cases, the surviving partner, the surviving spouse, has an increased awareness of how finite or how final life can be at points. And that's where this midlife review might be common, especially in a situation like that, right? They had this plan. They had this plan for where they were going to go, and maybe they're going to sell their house and move here, and they're going to join this organization, be a part of that as a couple, and now that's gone. So there's a lot of review that these folks might have secondarily to the death of a partner. As we know, intellectual ability, so learning continues throughout life. Adults continue to learn, right? Piaget, we're still talking about formal operations, but really this isn't anything new, right? We reach that formal operations as young adults, and it kind of continues to this point. Adults, for the most part, should still be able to have the ability to reason with complex problems and these types of things. You're going to hear this Bloom's hierarchy of cognitive development. Nothing I'm going to hold you to right now, but you're going to see this throughout doing classes in nursing. I mean, even when I think about when I write test questions for you guys in that, say, we always start out with a knowledge, right? You look at this pyramid that you've got in the slide in front of you, and the knowledge is that first base. In the knowledge and the comprehension kind of is that rote memory we've talked about before. Now, questions that we've worked through this semester even are application and analysis questions. It's taking that knowledge and comprehension you have of a topic and being able to apply it to a situation. But guess what that is? That's Piaget. That's that stage of formal operations. You can use complex problems of reasoning and that by taking the knowledge you have of something and applying it to a situation. So, there's Piaget's formal operations right in front of you there. A few perceptual changes, a lot of these I could almost speak to. Presbyopia, you'll hear about this. Actually, most of these terms next semester, or I'm sorry, in the fall in health assessment, you're going to see them again. So presbyopia is that farsightedness. They can't focus on items that are in close range. This is when folks, they go to the eye doctor, they end up wearing glasses, which I usually do when I'm not actually sure what I did with them. So that can be corrected with glasses or LASIK surgery. Pretty popular procedure. No, I haven't had it done. I'm kind of afraid of somebody shooting a laser into my eye, but that's just me. Glaucoma is a condition where the pressure inside of the eyeball increases, it's very dangerous, right? There's damage to the optic nerve, which can lead to vision loss and blindness and loss of peripheral vision. So peripheral vision is that as I'm looking at you guys right now, it's what I could see on the side here. So it's not what's in front of you, it's in your periphery. And a lot of times that's one of the first signs of glaucoma in a patient that we see is they say, well, I just can't see peripherally. So cataracts is an opacity of the lens. So the lens actually become cloudy. They can do surgery for that and correct that. Presbycusis, fancy word for loss of higher frequency hearing. So, I've said this before, pretty much every body part we have has a limited warranty. It's going to only work for so long. And then depending on, a bunch of different factors, stuff might start to break down. So we've got people that have been using their ears to hear for 30, 40, 50, 60 years at this point, right? And if they've been in a bad environment, an environment where there's a lot of loud noise, where they're not using hearing protection, these types of things, they might start to have this degradation of their hearing. And most of the time, higher frequency hearing is the first to go. But that's kind of a warning sign, right? I'm again the poster child for this. I've listened to sirens and loud noises my entire life, and as well as listening to music too loud when I was a kid. Right, my parents were always like, "Don't have the music turned up so loud, you're gonna hurt your ears." I probably should have listened to them, right? But the first thing that goes is that higher level, higher frequency. So anything that's a higher pitch, and hopefully most of you or all of us have already done the the hearing test. You put the things on your ears and they play all the different tones. Well, it's that really high tone, not the very low tone, but the high tone that goes first. So and also these folks start to have a diminished sense of taste. And at the beginning, it affects the ability to taste sweet and salty. And if we're in the classroom, I'd be like, all right, what's the problem here? So what is the problem, right? I can't taste salt as much as I used to. What am I going to do? I'm probably going to put more salt on what I'm eating. But as we talked about, salt and water like each other. Sodium in the salt likes water. So it's going to start to retain it. Which is a bad thing because it increases the amount of fluid in our system. It increases the amount of work that our heart is doing. It could increase our blood pressure, and we know what happens then, right? So the important thing here is a nurse in the appropriate setting. The teaching point would be don't use salt on your foods to increase the taste. Find other spices or find other ways of doing so because a lot of salt is a bad thing. Okay, self-perception, self-concept. The one that I'm most interested in on this slide is right there in the middle, as it has been all along, Erikson's theory. So generativity versus stagnation. So for people to be successful with this stage of Erikson, they have this sense of productivity. I have this sense of doing something when I'm at work, doing something with my life, completing projects, all these types of things, right? Could be creativity and, caring for others. And that caring for others could be caring for my wife, caring for my children, caring for my parents, or as you are all going to do, and as I do as well, caring for the anonymous people, caring for our patients, these types of things. The flip side of that, and the negative part of Erikson here, is that lack of accomplishment. This is where that midlife crisis kicks in, right? You've got somebody that has been very self-absorbed, very self-important throughout their life, and they reach this point and they look back and they're like, well, what have I really accomplished? And if there's a lack of accomplishment in whatever realm, in job, in family, in anything like that, Erickson would tell you that they've failed at this stage, because they have that lack of accomplishment, or if they're self-absorbed. We talked about being egocentric with younger folks, but we also have seen where you usually grow out of that, but some people don't. So if you have somebody that's self-absorbed, that has a lack of accomplishment, Erickson would tell you that they've stagnated. As far as self-concept is concerned too, and we kind of talked about this at the beginning, but I'll reiterate it again here. There's physiological changes that go on with the aging person, with the middle-aged person, and that could have an effect on self-esteem. Graying hair, wrinkles that form, body shape, right? That could have a negative impact on somebody's self-esteem, trust me. And also we've talked about women that are going to go through perimenopause, which is that period where the body starts to go through the change, but it hasn't completely. In menopause, they can be subject to mood swings, they can be subject to nervousness, anxiety, they can be fatigued and depressed because be it the change in the hormones or just the fact that they know their bodies, again, it goes back to that, where am I in my life, midlife kind of review thing. And, they know that their body's going through a change and they're going to change because of it. So there could be some depression that might come in there. Some patients might be indicated for hormonal therapy, although there might be some controversy out there related to that. Alternative products. So, we've talked about complementary alternative medicine and those types of things. The problem with those is that, some women might use these to help with the effects of that perimenopause stage or the menopause. But science has really shown that there's not a lot of scientific data on the benefit of using those. So in any case, if you're at a point where we're speaking with a patient working in that type of an environment, you may just caution them to the fact that there is little scientific benefit to some of those alternative products that they may think about using. A high proportion of adults remain sexually active throughout their middle-aged ages. I've talked about this before. In pregnancies, 77% are unintended. They've had their kids, they've kind of had that stereotypical life that they're moving along with, and they don't intend to have any more children, but sometimes it happens, right? And I've also mentioned the fact that perimenopausal women can still get pregnant. I mean, even though we're talking about women that are in their late 40s, right, the chance still exists. And if they're with a male partner, men can still remain viable. Stats have shown up into their 80s or their 90s. So it goes back to, they didn't intend to become pregnant, but it can still occur. It can still happen. The problems is that there's a higher incidence of both fetal complications because mom is older, and also maternal death too, right? We've talked about how as people get older, those chronic conditions can develop and can proliferate. That's no different here with mom. Maybe mom comes into her 40s, into her late 40s, and she's developed diabetes, or she's developed some cardiovascular issue, high blood pressure, or something like that. The pregnancy is only going to make that condition worse potentially. So that's why they're at higher risk for maternal death. Overall, there's changes in the reproductive system, decreased, slower arousal, orgasms are less intense, decreased desire. And the problem is that last bullet point there, and the American cultural value, or at least it has been in the past, is on youth and beauty. And that can be challenging for a middle-aged woman. So, understand that those issues, if you happen to be in an area where you're working with middle-aged women, that, that it goes back to that really is that last bullet point. Although it's under sexuality and reproductive pattern, I think we could all argue that could also go under the self-esteem, under the self-perception, self-concept pattern as well, too. So men can have issues with impotence, premature ejaculation. There's medications out there for those types of things. The biggest thing there is the fact that they should be talking to their practitioner, talking to whoever they go to, their doctor, their nurse practitioner, their PA, whoever, about those issues. Women can have abnormal bleeding. That's where that perimenopausal period comes in. Their periods aren't as regular as they used to be. It doesn't mean that they're not going to still ovulate. It just means that they're not as regular as they used to be. And that secondary amenorrhea, that's without menses. STDs, it's been found that, and we've talked about HPV a little bit. I know you'll hit it hard once you get to health assessment next year. But HPV causes 90% of the cervical cancers. That's why in the young adults, it's important for the vaccination, for them to get the vaccination, and to have the screening and all these types of things, right? Our adults that are over the age of 50 are considered a hidden risk group as far as HIV and AIDS is concerned. Twofold. Number one, they're less knowledgeable about HIV and AIDS. I think that before 50, and I can still say I'm before 50 at this point. So for those of us that are under 50, I think that there's been a lot of awareness. There's been a lot of discussion. It's something that we've all grown up with, and it's just always been there. But people that are older than 50, and I think of the folks, remember, middle-aged, we go up to 65. So those that are 60 to 65 in that, that isn't something that they've always grown up with or dealt with or anything like that. So they might have less knowledge related to it, and they may be less likely to discuss any of their sexual behaviors with their providers. It's not always an easy topic to talk about overall, and I think that the older that your patient gets, the less comfortable they're going to be discussing anything related to sexual behavior, especially if it had to do with HIV and AIDS. Remember that the older generation, when it came to an HIV diagnosis, that was almost a death sentence. We've gotten a lot better at treating this. We've talked about this before, right? The HIV has now become a chronic condition as opposed to an acute condition because we can treat this. But that's not the stigma that a lot of people that are older have, right? When this first occurred, we're talking a long time ago, but when it first occurred, everybody was very afraid of it because it had such a mortality rate that attached to it. So they may be less inclined to discuss anything related to their sexual behavior or specifically HIV and AIDS. So at this point, we think about people that, they've been alive quite a while, and, maybe they've developed coping mechanisms related to the stress that they may come into contact with. Or maybe they don't, right? Stress hardiness is about controlling the situation, the challenge to the person because of the stress, and their commitment to overcoming the stressors. Again, at this point, there should be a maturity related to defenses related to coping and distress in that. But if they didn't learn good coping strategies when they were younger, are they going to be effective now? Or are they going to continue to try and do the same thing that they've always done that's never worked? So Framingham study, incredibly interesting study. I'm not going to go too far into it, but I'm going to mention it. So if you go back to Blackboard for this week, I probably went back too far, sorry. In this week's content folder, there's a link to the Framingham study. Very interesting. Again, I kind of wish that we were there and we could discuss this because I've had people in the past that knew about it, that lived near there. But this is a study that's been going on for a very long time. They're in about their, well, let me get to the website. They're in about their 4th or 5th cohort now. And it started in 1948. And basically from 1948 until pretty much now, they've had all these cohorts and they've just been following these people. Doing healthcare monitoring, health promotion monitoring, and that. The thing here is a lot of the advances that we've made as far as cardiovascular disease is concerned comes from this study. So they're studying these folks and seeing, what their diet, what their weight, all of these types of things, how that impacted their health. And these results have driven a lot of the recommendations that we've seen in those types of things. So back to the PowerPoint slides. The Framingham study has found that worry and conflict and anger and ambitiousness can affect somebody's blood pressure. That's why everybody at any age needs to have good stress coping strategies. But remember, we've talked about how much stress that a middle-aged person can be under, right? There's worry about their job, there's worry about their family, there's conflict with the changes that are occurring in their life. Ambitiousness is just that wanting to continue to succeed in that. But all of these things can affect somebody's blood pressure, right? Make it go up. And once you have a person that has high blood pressure, we know that starts to have an impact on, really all their entire cardiovascular system. And that's what came from this Framingham study. As well, we've talked about the fact that middle-aged folks have to deal with the death of a parent. The important thing here, and I can't stress this enough, is that to prepare, right? For the middle-aged person, a good teaching point here is prepare, because at some point what happens if that parent can't make those decisions for themselves anymore? The story I'll go to is my father. He was able to make his decisions on his own, healthcare decisions, financial decisions, all these types of things, until earlier this year. And then he just couldn't anymore. His cognitive ability dropped so far that he couldn't make decisions for himself anymore. So guess who? Me. It admitted to me now. And we have power of attorney for him. We have advance directive for him. So we prepared, kind of having those conversations with him. So there was a bit of control there, but there were things that needed to be done after his cognitive ability dropped as far as it did. But these types of things are things that nursing and practitioners should be discussing with their middle-aged patients and with their older patients too. Beliefs are formed early in life, right? That value, that belief pattern are kind of things that we've developed earlier. We've considered all of the options as far as our beliefs are concerned. So really, once you reach the middle age, they might be difficult to alter. However, if there's a crisis, people may have a crisis of faith, depending on if something tragic has happened in their family and that, right? They might review those beliefs and those values during a crisis. They consider that there's some moral transitions in the middle age, more so to bettering the relationships that they have with others, that middle-aged folks are responsible to others and that they value others. Erickson kind of thought that caring is a middle-aged virtue. Here's our friends Kohlberg and Gilligan again. We've talked about them before, so I'm just going to keep going. So physical agents that may have an impact on the middle-aged people. Ionizing radiation. So there can be cancers that can be caused by medical tests and procedures. Just by virtue of chronological age, a middle-aged person is going to be probably exposed to more ionizing radiation in their lifetime than younger generations. Stuff that you can find in water pollution or in air pollution can lead to carcinomas, cancers. And then also noise pollution. I kind of talked about that earlier, right? Is an occupational hazard depending on where people work. Construction workers, people working in manufacturing and that, right? There's a potential for hearing loss if they're not using the right hearing protection, and if there aren't other protections in place, regular checkups, like yearly checkups to check their hearing and those types of things. Biological agents, that these are types of things that can be transmitted through the air or food and water. They can enter through the respiratory tract, right? They're through the air, they come through the respiratory tract. If they're come in food and water, they go through the GI tract. A couple of examples are hepatitis A, which is the fecal-oral route. This is your food handlers, people that are preparing food that go and use the facilities, don't wash their hands, and go back to making food again. That's how hepatitis A, that's where it comes from, poor sanitation practices, right? And that's probably going to be transmitted through the GI tract. Versus hepatitis B, which we've kind of talked about in class, and I think you've all had vaccinations and that against this. It's a bloodborne pathogen, so it comes from blood. And for us, it's a health hazard. It's an occupational hazard. It's a health hazard for health professionals. Needle sticks, or if there's blood on surfaces and that's not cleaned up like it should be, or we're not using the right personal protective equipment, gloves and gowns and masks and eye protection, all these types of things. Pneumonia is a biological agent that will impact everybody, and including middle-aged folks. But get the vaccine. This is the time of year where they should be thinking about doing it, right? And herpes zoster, which is shingles, there's a vaccine available for that as well. Chemical agents, so these things that they can get from the workplace or industry. Around here, like I think about those that end up with black lung disease from working in the mines and working in the coal industry. That's that pneumoconiosis, sorry. But they can develop that. That's an environmental process, a chemical agent that's going to negatively impact people. We hear about asbestos exposure. This, again, could come from people that are in construction or in demolition, right? We're taking down old homes and that. Or there can be organic carcinogens. So carcinogens, again, are those things that cause cancer. Benzene and PVC and other types of organic things. Sorry. Tobacco. For middle-aged folks, you may have somebody now that's been smoking cigarettes for over 30 years. Bad stuff. And we talked about this before in class. Increases the risk of heart and lung disease and cancer. And there are over 2,000 known chemicals in cigarettes. Tar, cyanide, formaldehyde, carbon monoxide from that. Just bad stuff. But this is why when we talk about this is one of the reasons why when we talk about how the most prevalent causes of death changes from accidents to, this is where that lung disease starts to kind of filter in for people that are in their later middle-aged years. Social determinants of health. So what things in society and in the environment will have an impact on somebody's health, right? As far as culture is concerned, we've talked about this before. People have different interpretations of what health and illness is and what they should do about it. So that's going to have an impact. We see immigrants that are living in poverty, that have poor living conditions. That's going to have a negative impact on their health care, right? As far as economics are concerned, the net income for the middle-aged folks throughout the lifespan, the net income is probably the highest. But at the same time, right, middle-aged people probably have greater financial responsibilities. So I'm younger, I'm in my early 20s, here I am, I've just finished college, I'm working for an ambulance. All I've got to worry about is myself and clothes and food and a roof over my head. Fast forward 30 years, now I've got a family I have to worry about, right? 3 kids, and they're all in college and, everything that goes along with that. So even though the income might go up, the financial responsibility is probably going to increase as well, too. Depending on where folks live, right, there can be different healthcare delivery systems that may have an impact on them. Official agencies, state and federally funded, so I'm thinking about welfare programs. I'm thinking about, the 65, you're starting to talk about Medicare for these folks, too. Also, voluntary agencies. That's a bad word. Volunteer agencies. How about we go with that? The one thing I key in on there is the American Cancer Society. Remember that that cancer is beginning to move up the list on causes of death, right? Most prevalent. American Cancer Society is a wonderful tool, a wonderful resource for folks to use if they're newly diagnosed, as far as whatever resources they might need. And then service organizations such as the YMCA. I know that where I used to live, the YMCA, on one hand, it was a place where people went to swim in the pool to get exercise or to use the gym to get exercise. But they also had services they had dormitories. There was a YMCA and there was a YWCA, and they both had dormitories for lower income or homeless people, summer shelters where they could live. So that might that's a determinant of that's a social factor that could help determine a person's health. Also, hospice. So again, we're talking about cancer in some of these folks. Have they reached the point where we might start to think about hospice services for them? Healthcare is expensive, right? As the population ages, we're using more health resources. Unemployment obviously is going to create stressors for these folks because of health insurance. Right? If somebody's not employed, they potentially don't have health insurance, or they probably don't, right? So what are we going to do for these folks? As always, we're going to assess them. We're going to talk about their individual health history. Baseline health can be done through employment physicals. Hopefully, if they had good health care when they were young adults, we've already done that baseline health, right? But if they haven't, employment physicals are a really good spot to do that baseline health, to look at them year to year to year. Again, I pick on myself. For 20 plus years, probably the only time I ever went to the doctor was yearly for my employment physical, because I had to have a physical to be a firefighter. But at least I was there, right? And then there were conversations if there was, if my cholesterol came back high or something like that. The practitioners there were very good about that. That's a good time, as we've talked about before, to talk about health promotion. Right out of my head, you guys. I'm sorry. Health promotion initiatives for them to do. Also, the nurses can look at environmental hazards and workplace safety. A lot of times when you go to industries or something like that, there are nurses there, and beyond doing employment physicals and keeping track of employee health, they're the ones that are identifying environmental hazards, or helping with workplace safety. Something as simple as, I'm a new nurse working in an industry, a manufacturing plant, and there's a lot of loud machinery there, and nobody's wearing hearing protection. Okay, hello. So let's get some hearing protection in here, or something like that. So nurses will also screen for disease. We're going to look for health risks. We're going to look for bad health behaviors, and we talked about that a lot before, ad nauseum at this point. So education is we're going to emphasize, self-health promotion. Get off the couch. Eat a good diet, all these types of things. Safety for folks, fall prevention. It's not outside the realm of possibility that you're going to have folks that, in the middle age range, as you get to the 60, 65 range, maybe they have trouble with ambulating, with walking around or something like that, especially later in the day or at night or something. So, we want to prevent falls because that's bad. Fires and firearms we talked about before, and also driving, we haven't really, when we get to the older population, to the next chapter, we're going to talk about this a lot more as far as safety and driving and that. But we talked about, that it's not outside the realm of possibility that something as simple as they start having problems with their vision. That's a safety issue, right? So if you're working in the appropriate environment where you can identify that as a safety issue and help get the resources that they need, get an eye doctor appointment, get some glasses or something like that, you can positively impact that. And then organizational health promotion programs. Nurses can be part of these as well. Again, it goes back to looking for environmental hazards, or if you're just somewhere where, you can encourage, everybody go out at lunchtime for a bit and go for a walk or something like that, right? That's a health promotion program in and of itself. So that's the end of the slideshow. I'm going to throw a few Nearpod type questions in at this point, although they're Edpuzzle type questions. Work through those, and as always, please, before Thursday, if you have any questions, reach out, let me know, okay? Hopefully this is beneficial to you, and have a good day, and I'll see you guys Thursday.